The first death in the United States was February 29, 2020. And I knew at that point in time, because I had been following what was happening in China and in Italy, I knew we were going to be in a problem, a big problem as far as it pertains to the African American community. Because what we know in America is that racial health disparities exist across the board, and whether that's infant maternal mortality, whether that's cancer mortality, cardiovascular, neurovascular mortality. African Americans have higher death rates for 8 of the 13 leading causes of death. You can't talk about the comorbidities without talking about the systemic racism that leads to those comorbidities in certain communities. What do I mean by that? You can't talk about respiratory illnesses, asthma, and chronic bronchitis without talking about environmental pollutants and where we're choosing to put industries in certain zip codes that are polluting the air, that's polluting the water. You can't talk about diabetes and obesity if you're not talking about food deserts or food apartheid that we're now calling it, where there's not an eatery or natural food or fresh food produce that's within 20 miles range. You can't talk about the lack of health insurance or even, like I said, with our essential workers that are working sometimes 2-3 jobs at a time, without talking about the economic devastation of the communities, without talking about the redlining of the 1930s and how certain communities were targeted with these type of industries and not allowing for economic growth.
Health disparities have always existed for the African American community. But here again, with the crisis, how it's shining a bright light on how unacceptable that is. Because yet again, when you have a situation like the coronavirus, they are suffering disproportionately.
The impact that I fear is going to have in South Carolina, it hits me in a different place because my entire family is there. There are 10 counties out of the 46 that doesn't have a single hospital. 1 in every 5, more than 1 in every 5 counties, no hospital. And so what we're going to see is that when those underserved populations get sick, they're going to go to the neighboring county, as they should, to seek help. But that healthcare system is not built to take that mass of patients at one time. And if we thought we saw something bad in New York City that has 62 hospitals for that one city, then just wait till this hits the Deep South, where we see poverty has made its home and set roots. There are actually a group of us physicians working with lawyers to say, how can we make this legal? Where these corporations that are making billions of dollars a year on the backs of these workers that are underappreciated and underpaid, how can we hold them responsible for their employees in providing them not only PPE, not only the masks, not only the gloves, not only the gowns and the hand sanitizer that they deserve to have, but also the education of what does it mean to wear this mask? Know that you can't touch your face. If you have the mask, you can't use a glove to clean up areas and then touch your face, because you can transfer that virus straight into your airway just as well. We need to train them to let the grocery store workers know that coronavirus lives on plastic and stainless steel for upwards of 3 days. And so when customers are walking in, if they don't have on a mask and they are coughing, if it goes and it lands on that bag of potato chips, for instance, that if you then touch it even 10 minutes later, that virus is still very much able to contaminate your body. And if that basic level of education is not being handled, then that's negligence in my eyes. And regardless of which industry we have to go after, I won't stop until we do.